Hello guys, Assalamu alaikum and welcome to Revise Pathology. Today we are going to discuss on the topic and that is cell injury. So first of all in intro and let's know what is cell injury, okay? So first of all, cell injury is nothing but the effect of the variety of stress, okay, on the cell due to the etiological agents, okay, and that results in the changes in its internal and external environment, okay? It's known as cell injury. Now let's see it here, let's repeat it again. The effect of the variety of stress due to the etiological agents that the cell encounters, resulting in the change in its internal and external environment. It's called as cell injury. Now, types of cell injury. There are three types of cell injury, that is reversible cell injury, irreversible cell injury, and adaptations. Okay, repeating it again. The types, there are three types: reversible cell injury, irreversible cell injury, and adaptations. Now let us see what are the internal changes that occur, okay, due to internal changes that occur in reversible and irreversible cell injury. Or let us see what are the etiological factors of reversible cell injury, irreversible cell injury, and adaptations. Okay, let's go on. So, guys, coming to the etiology, let's see what are the etiological factors for the cell injury or for all the different types of the cell injury, that is reversible cell injury, irreversible cell injury, and adaptations. And afterwards in the next step we will see what are the things that includes in adaptation, in irreversible cell injury and reversible cell injury. Okay, so first let's see what are the etiology. So the first etiology is hypoxia, that's lack of oxygen. Then is ischemia, that is complete stoppage of the blood flow, fine, or oxygen. Next, there are chemical agents, microbial agents, aging, immunological agents, iatrogenic factors, and idiopathic factors. Repeating it again. So the first one is hypoxia, ischemia, chemical agents, microbial agents, aging, immunological agents, iatrogenic factors, and idiopathic factors. All right, now let's see what are the things that includes in the different types of cell injury. Okay, what are their what are the steps that involves in different types of cell injury? How will reversible, irreversible, reversible cell injury, irreversible cell injury, and adaptation affect the cell? So let's dig further. So guys, as we have discussed that there are three types of cell injury, okay, and that is reversible cell injury, irreversible cell injury, and adaptations. Now let us see when does these responses occur. Okay, basically I wanted to tell cell responses, but I was not getting it in my mind. The accurate word is cell responses. Okay, before was etiology, now is the cell responses. Okay, so we will see these are the three cell responses or three types. See, first three types of injuries occurs. Okay, what are those? Reversible cell injury, irreversible cell injury, and adaptations. Or you can tell it as cell responses also. Okay, now let us see how and when a cell will respond to a particular situation. Now, adaptations. So what is an adaptation? Basically, from the word itself, in case if there is an altered function or altered functional demand in a cell, okay, that is created due to any of the etiology, okay, so there will be a morphological change in the cell, okay, and as soon as that stress or that etiology is treated or removed, the cell gets back to its normal position, to its normal shape, to its normal morphology, and to its normal function. Okay, so there are different types of adaptation. Okay, the first one is, and these okay, well, different types of adaptations, and they are as follows. First one is atrophy, hypertrophy, hyperplasia, aplasia, metaplasia, and dysplasia. Okay, so when the adaptation will occur, once there is an altered functional demand, and what will happen? There will be a morphological change in the cell. Okay, this is number one. Next is coming your reversible cell injury. Now, when will a reversible cell injury occur? Once there is a mild to moderate stress. Okay, then once there is a mild to moderate stress due to any of the etiological agent, for example, hypoxia, ischemia, any chemical agent or microbial agent, or due to aging or due to any any environmental factors, fine. That time reversible cell injury might occur. Okay, and it occurs at different levels. It can occur at cellular level, it can occur at subcellular level. Okay, these changes will occur there, and once the stress is being removed, the mild to moderate stress is being removed, the cell starts functioning normally. Now, what are the reversible cell injuries? What sort of reversible cell injuries will occur there? Degenerations can occur, subcellular alterations can occur, and intracellular accumulations can occur. Okay, why? If there is a mild to moderate stress. Now, coming to the irreversible cell injury. Irreversible cell injury, from the word itself, if there is a continuous persistent stress, all right, or severe stress, persistent or severe stress, that time cell death will occur, and that time and that situation is called as irreversible cell injury. So when does irreversible cell injury occur? Once there is a persistent or severe stress on the cell due to any of the etiological agent, and that will lead to cell death. All right, so that's called as irreversible cell injury. So repeating it again, what are the cellular responses or the types? Is adaptations. First, in adaptation, when does an adaptation occur? Once there is an altered functional demand, and what will happen there? A morphological change will occur. Okay, and what are the different types of adaptations? Atrophy, hypertrophy, hyperplasia, aplasia, metaplasia, and dysplasia. All right. Next, reversible cell injury. When does a reversible cell injury occur? Once there is a mild to moderate stress at any cellular level of the cell. Fine, that time a reversible cell injury can occur, and reversible cell injury means the cell will function normal after once the stress is removed or once the stress is treated. Okay, whether it is mild or moderate stress. Okay, so what are the types of adaptations that will occur in reversible cell injury? That is degeneration, subcellular alterations, or intracellular accumulations. All right. Now, the third one and the last one, that is irreversible cell injury. So, what will happen in irreversible cell injury? It occurs due to persistent or severe stress, and from the word itself, irreversible. The injury to the cell cannot be reversed, and it will lead to cell death. All right. Now let's further go and dig deep into reversible and irreversible cell injury. Let us see what occurs there at the cellular level. All right, so let's go on. So, guys, as per the next topic, and that is the molecular changes. Okay, the molecular changes or the pathogenesis of ischemic and hypoxic cell injury. That means what happens in reversible and irreversible cell injury? Fine, due to ischemia or hypoxia. Okay, they are also called as hypoxic cell injury or ischemic cell injury. Fine, and let's see what happens at the molecular. What are the molecular changes that occur? Okay, or let's see, or we can also tell it as the pathogenesis. Fine, of the irreversible cell injury and reversible cell injury at molecular level. Fine, or else you can also say is pathogenesis of ischemic and hypoxic cell injury. Fine, there are three things for it. Okay, so first of all, when ischemia and hypoxia occurs at a time, three processes will start. All right, first there will be a decrease in ATP generation. Next, toxic O2 radicals, or you can tell it as free radicals. Next, there will be decrease in the synthesis of the membrane of the phospholipid. Okay, the three processes will start. Okay, in case there is ischemia or hypoxia itself, from the, it means that decrease in the O2 level, and ischemia where there will be a complete stoppage of O2 or blood supply. Fine. Next, first we will see what happens once there will be a decrease in ATP generation. Okay, so once there is a decrease in ATP generation, that time there will be an increase in calcium, systolic calcium. Okay, with the result, what will happen there? In the mitochondria also, there will be an increase in the calcium levels. Fine. So once in the mitochondria also there will be increase in the calcium levels, it will activate two processes. First one is phospholipase activation and protease activation. In protease activation, what happens? Cytoskeletal injury occurs. That will lead to membrane damage, the cell membrane damage, the damage to the cell membrane. So what will be there? You see, protease activation, that will lead to cytoskeletal injury and it will lead to membrane damage. On the other hand, in phospholipase activation, what will happen there? There will be increased loss of membrane phospholipid and lipid breakdown products will occur. That will also lead and contribute to membrane damage. The cell membrane will get damaged. Now, what happens then? The other two processes where there are free radicals and where there is decrease in synthesis of the membrane phospholipid, it directly acts on the increase in loss of membrane phospholipid, which goes on in the process of phospholipase activation. Okay, and in free radicals, what will happen? Lipid peroxidase damage will occur. Directly, lipid peroxidase damage will occur, which will lead to membrane damage. Now, all this will constitute together to damage the cell membrane. Okay, and what will happen after that? There will be liberation of intracellular enzymes that will lead to three consequences. What is that? Your nuclear changes, cell death, and increase in some enzymes such as you can say it as serum enzyme estimation, SGOPT, and other sort of enzymes will be increased. Okay, this is all the molecular changes that takes place in cellular in reversible or irreversible in cell injury. Okay, repeating it once again. First of all, as soon as there will be ischemia or hypoxia in the cell, okay, what will happen in that? Three processes will occur. First, there will be decrease in ATP generation, free radicals will come, and decrease in synthesis membrane of phospholipid. Fine. Coming towards the process of decrease in ATP generation, what will happen there? There will be increase in systolic calcium. That will lead to increase in calcium level in mitochondria. Fine. Once there will be increase in the systolic calcium, it leads to two processes, that is phospholipase activation and protease activation. Once there is the protease activation, it will lead to cytoskeletal damage. That will cause the damage in the cell membrane. Next, in phospholipase activation, in this process, it will lead to two things. What are those? Increase in the loss of membrane phospholipid and lipid breakdown of products will occur, due to which there will be damage in the cell membrane. Now, coming from the side of free radical, once this process occurs, what will occur there? Lipid peroxidase damage will occur, that will lead to membrane damage. And once the decrease in the third process, what is going on, once hypoxia and ischemia hits the cell, what happen? What will happen is there that increase in the synthesis of the membrane phospholipid, which will directly lead to increase in the loss of membrane of phospholipid. Fine. All these factors will contribute. Okay, what are those? Increase in the loss of phosphomembrane, phospholipid, lipid. Next is lipid breakdown of the products, cytoskeletal injury, and lipid peroxidase damage. Okay, all this 1, 2, 3, 4. All these four will contribute towards the damage in the membrane or damage of the cell membrane. Due to which, what will happen? There will be liberation of the cellular enzymes, and yes, intracellular enzymes, I'm sorry, liberation of intracellular enzymes, which will lead to nuclear change, cell death, and serum enzyme estimation. So this is all the changes that will occur at the cellular level, or the molecular changes that will occur in irreversible cell injury and reversible cell injury. Okay, that's all for today, guys. And now the topic of cell injury will be divided into many parts. Okay, the next topic will be inshallah on the morphology of irreversible cell injury and reversible cell injury. Fine. So till then, see you guys. Stay tuned to my channel Revise Pathology. Like, comment, and share my videos. And take care of your health. Till then, Allah Hafiz.
Think about the way that you move around up and down on that stage as your future vibes. Bright lights in